Hello everyone, we are Team Edit for It ARG, and today we are introducing InsightX. It is a simple tool that lets health professionals upload a chest X-ray or even take a picture of one and get an instant risk flag with a clear heat map. X-rays are relatively easy to get in most of the areas of Nepal, but in many rural parts, mostly health posts, there are no specialists to read them. And to be clear, this is AI screening support for medical staffs, not a diagnosis. Globally, lung cancer causes around 1.8 million deaths every year, and many are diagnosed late. So, timing plays a crucial role in saving lives. In lung disease, if lung disease is caught early, it is far more treatable. But if caught late, chances drop sharply. Nepal has highest death rate from chronic lung disease in the world. About 183 out of every 100,000 people die.
So our approach is really practical. We use what already exists, the chest X-ray. We help staff spot high-risk cases first, as our secure API provides immediate risk assessment. So due to the simple interface of our tool, nurses and health assistants at rural health posts can easily use our app. Moreover, the app works all with low bandwidth. And some of the potential impact of our tool is that it flags suspicious chest X-rays instantly, helping catch serious conditions early, meaning that patients can reach specialists before disease worsens. So survival can be 7 times higher. It reduces unnecessary trips, speeds of referrals, and prevents specialist overload so they can provide better care where needed. Plus, it generates data to inform better screening policies nationwide in the future.
We train our own model on checks per small dataset, clean and standardize the images. Using efficient net with CBAM attention, we achieve 86% accuracy. The model turns X-rays into probabilities for 14 findings. We simplify this into clear outputs, healthy, suspicious, or possible nodules. Grad-CAM heat map shows exactly where the model looked. If it flags the upper lung, that region glows, building trust with the clinicians. The app returns a screening card in seconds, risk tier, top findings, and bilingual summary. It also provides a one-page PDF and stores records for better patient history.
For the business scope, we're going to start with the deployment strategy, which is we're going to phase out starting with pilot clinics and then follow it up with broader expansion across rural health posts in Nepal. And then for monetization, we're going to explore partnerships with NGOs and government health programs to ensure long-term accessible service delivery. For scalability, we're going to expand beyond just lung disease, and once in Nepal, we're going to gain specific data to improve the model. We faced a lot of challenges, such as being present for the whole time, new frameworks, and lack of data sets. We also were able to learn a lot within the 36 hours and grow from the challenges.
All right, guys, here's a demo of our program. It's called InsightX. This is how the UI would look for the health professional. The health professional would be able to upload the image. For example, we are uploading this image right here, and once the image is uploaded, they could put some patient data and then analyze the X-ray image. You can see how quick it was. You can see on the left we have the original X-ray image, and then on the right we have the machine learning model learning from the image, and then also showing the Grad-CAM saying, okay, these two areas are contributing for this to be considered a healthy lung and the risk is low. And for that, the patient, if they want their report, they would be able to download the PDF or get a printout of it, which would be helpful for people in rural areas since they won't be able to access digital copies. It also gives you a screening summary where there's a clinical impression and recommendations. As this was a healthy lung, there was no recommendations. We can look at another example. Right-sided pneumonia. This is supposed to be someone who has an issue. Their details, analyze X-ray image, and then the machine learning model is able to infer that it has suspicious findings. The risk is high. The original X-ray is on the left, and on the right, you can see how it's making the decision that it's a high risk is on the red. You can still download the PDF, and on the left, you can see the impression says focal airspace, pulmonary opacity, and the recommendations are also given. So using this, even people in the rural areas would be able to get an insight into if they need a second opinion or they need to go to a better hospital, they'd be able to do that.